तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। भूर्भुवस्सुवः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्।
जय श्री गणेश विघ्ननाश गजानन। जय श्री गणेश विघ्ननाश गजानन। जय श्री गणेश विघ्ननाश गजानन। सर्वसिद्धि सुरंजना विद्या बुद्धि सर्वसिद्धि सुरंजना विद्या बुद्धि सर्वसिद्धि सुरंजना विद्या बुद्धि सर्वसिद्धि सुरंजना। जय श्री गणेश विघ्ननाश गजानन। जय श्री गणेश विघ्ननाश गजानन। जय हेरंबा श्री जगदंबा नंदना। जय हेरंबा श्री जगदंबा नंदना। जय हेरंबा श्री जगदंबा नंदना। एकदंता दयावंत शुभानना। मंगलदायक श्री विनायक वंदना। मंगलदायक श्री विनायक वंदना। मंगलदायक श्री विनायक वंदना। मंगलदायक श्री विनायक वंदना। जय श्री गजानना जय हिरम्बा श्री जगदम्बा नन्दना एकदन्ता दयावन्त शुभानना मंगलदायक श्री विनायक वंदना मंगलदायक श्री विनायक वंदना जय श्री गणेशा विघ्ननाश गजानना सोहम सोहम ध्यान करो सोहम सोहम ध्यान करो सद्गुरु साई ध्यान करो सद्गुरु साई ध्यान करो सोहम सोहम ध्यान करो सोहम ब्रह्मा सोहम विष्णु सोहम ब्रह्मा सोहम विष्णु सोहम ब्रह्मा सोहम विष्णु सोहम ब्रह्मा सोहम विष्णु सोहम साई ध्यान करो सोहम साई ध्यान करो सोहम साई ध्यान करो सोहम साई ध्यान करो सोहम आत्मा शिव परमात्मा सोहम आत्मा शिव परमात्मा सोहम आत्मा शिव परमात्मा सोहम आत्मा शिव परमात्मा ब्रह्मानंद से हृदय भरो ब्रह्मानंद से हृदय भरो ब्रह्मानंद से हृदय भरो ब्रह्मानंद से हृदय भरो सोहम सोहम ध्यान करो सद्गुरु साई ध्यान करो सद्गुरु साई ध्यान करो सोहम सोहम ध्यान करो सोहम सोहम ध्यान करो सोहम ब्रह्मा सोहम विष्णु सोहम ब्रह्मा सोहम विष्णु सोहम सोहम साई ध्यान करो, सोहम साई ध्यान करो। सोहम आत्मा शिव परमात्मा, सोहम आत्मा शिव परमात्मा। ब्रह्मानंद से हृदय भरो, ब्रह्मानंद से हृदय भरो। ब्रह्मानंद से हृदय भरो, ब्रह्मानंद से हृदय भरो। सोहम सोहम ध्यान करो। अरुणारमणा श्री गुरुदेवा,
अरुणारमणा श्री गुरुदेवा,
अरुणारमणा श्री गुरुदेवा,
अरुणारमणा श्री गुरुदेवा।
शेषारमणा सद्गुरुदेवा,
शेषारमणा सद्गुरुदेवा,
शेषारमणा सद्गुरुदेवा,
शेषारमणा सद्गुरुदेवा।
अरुणारमणा श्री गुरुदेवा,
अरुणारमणा श्री गुरुदेवा।
भवभयहरणा श्री साई देवा,
भवभयहरणा श्री साई देवा,
भवभयहरणा श्री साई देवा।
भवभयहरणा श्री साई देवा।
गुरु है सतचित आनंद देवा,
गुरु है सतचित आनंद देवा,
गुरु है सतचित आनंद देवा,
गुरु है सतचित आनंद देवा।
आनंद देवा श्री साई देवा,
आनंद देवा श्री साई देवा,
आनंद देवा श्री साई देवा,
आनंद देवा श्री साई देवा।
अरुणारमणा श्री गुरुदेवा,
अरुणारमणा श्री गुरुदेवा,
शेषारमणा सद्गुरुदेवा,
शेषारमणा सद्गुरुदेवा,
अरुणारमणा श्री गुरुदेवा,
अरुणारमणा श्री गुरुदेवा।
भवभयहरणा श्री साई देवा,
भवभयहरणा श्री साई देवा,
गुरु है सतचित आनंद देवा,
गुरु है सतचित आनंद देवा,
आनंद देवा श्री साई देवा, नमो नमो हे परमेश्वर नमो नमो गुरुदेवाय नमो नमो गुरुदेवाय नमो नमो ओंकाराय नमो नमो ओंकाराय नमो नमो ओंकाराय नमो नमो ओंकाराय नमो नमो पर्तिपुरीश्वर नमो नमो पर्तिपुरीश्वर नमो नमो पर्तिपुरीश्वर नमो नमो पर्तिपुरीश्वर नमो नमो जगदीश्वराय नमो नमो जगदीश्वराय नमो नमो जगदीश्वराय नमो नमो जगदीश्वराय नमो नमो प्रशान्तीश्वर नमो नमो प्रशान्तीश्वर नमो नमो प्रशान्तीश्वर नमो नमो प्रशान्तीश्वर नमो नमो गुरुदेवाय नमो नमो गुरुदेवाय नमो नमो हे परमेश्वर नमो नमो हे परमेश्वर नमो नमो गुरुदेवाय नमो नमो गुरुदेवाय नमो नमो ओंकाराय नमो नमो ओंकाराय नमो नमो पर्तिपुरीश्वर नमो नमो पर्तिपुरीश्वर नमो नमो जगदीश्वराय नमो नमो जगदीश्वराय नमो नमो प्रशान्तीश्वर नमो नमो प्रशान्तीश्वर नमो नमो प्रशान्तीश्वर नमो नमो प्रशान्तीश्वर नमो नमो गुरुदेवाय नमो नमो
मानस भज रे गुरुचरणं
मानस भज रे गुरुचरणं
मानस भज रे गुरुचरणं
मानस भज रे गुरुचरणं
दुस्तर भवसागर तरणं
दुस्तर भवसागर तरणं
दुस्तर भवसागर तरणं
दुस्तर भवसागर तरणं
गुरु महाराज गुरु जय जय
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 साईनाथ सद्गुरु सत्य साईनाथ सद्गुरु जय जय
साईनाथ सद्गुरु जय जय
ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः
ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमो
अरुणाचल शिव अरुणाचल शिव अरुणाचल शिव अरुण शिव
अरुणाचल शिव अरुणाचल शिव अरुणाचल शिव अरुण शिव
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
मानस भज रे गुरुचरणं
मानस भजरे गुरुचरणं
दुस्तर भव सागर तरणं
दुस्तर भवसागर तरणं
गुरु महाराज गुरु जय जय
गुरु महाराज गुरु जय जय
साईनाथ सद्गुरु जय जय
साईनाथ सद्गुरु जय जय
ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः
ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमो
अरुणाचल शिव अरुणाचल शिव अरुणाचल शिव अरुण शिव
अरुणाचल शिव अरुणाचल शिव अरुणाचल शिव अरुण शिव
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा
मानस भज रे गुरुचरणं दुस्तर भव सागर तरणम् जय गुरु साई राम
जय गुरु साई राम
जय गुरु साई राम
जय गुरु साई राम
जगद्गुरु सत्य साई राम
जगद्गुरु सत्य साई राम
जगद्गुरु सत्य साई राम
जगद्गुरु सत्य साई राम
जय गुरु साई राम
जय गुरु साई राम
ब्रह्म विष्णु शिव 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 साई राम
पर ब्रह्म रूप 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 साई राम
माता पिता गुरु 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 साई राम
जगद्गुरु सत्य साई राम
जगद्गुरु सत्य साई राम
जगद्गुरु सत्य साई राम
जगद्गुरु
सत्य साई राम।
जय गुरु साई राम।
जय गुरु साई राम।
जगद्गुरु सत्य साई राम।
जगद्गुरु सत्य साई राम।
जय गुरु साई राम।
जय गुरु साई राम।
ब्रह्म विष्णु शिव साई राम।
ब्रह्म विष्णु शिव साई राम।
पर ब्रह्म रूप साई राम।
पर ब्रह्म रूप साई राम।
माता पिता गुरु साई राम।
माता पिता गुरु साई राम।
जगद्गुरु सत्य साई राम।
जगद्गुरु सत्य साई राम।
जगद्गुरु सत्य साई राम।
जगद्गुरु सत्य साई राम।
जय गुरु साई राम। शीतल चरणं कोमल चरणं मंजुल चरणं मम गुरु चरणं।
शीतल चरणं कोमल चरणं मंजुल चरणं मम गुरु चरणं।
शीतल चरणं कोमल चरणं मंजुल चरणं मम गुरु चरणं।
शीतल चरणं कोमल चरणं मंजुल चरणं मम गुरु चरणं।
मृदुल चरणं अनुग्रह चरणं।
मृदुल चरणं अनुग्रह चरणं।
मृदुल चरणं अनुग्रह चरणं।
मृदुल चरणं अनुग्रह चरणं।
सद्गुरु चरणं सदा स्मरामि।
गुरु चरणं सदा स्मरामि।
सद्गुरु चरणं सदा स्मरामि।
गुरु चरणं सदा स्मरामि।
प्रेमदाता साई गुरुनाथा।
प्रेमदाता साई गुरुनाथा।
प्रेमदाता साई गुरुनाथा।
प्रेमदाता साई गुरुनाथा।
पावन चरणं सदा भजामि।
पावन चरणं सदा भजामि।
पावन चरणं सदा भजामि।
पावन चरणं सदा भजामि।
शीतल चरणं कोमल चरणं मंजुल चरणं मम गुरु चरणं।
शीतल चरणं कोमल चरणं मंजुल चरणं मम गुरु चरणं।
मृदुल चरणं अनुग्रह चरणं।
मृदुल चरणं अनुग्रह चरणं।
सद्गुरु चरणं सदा स्मरामि।
गुरु चरणं మంజుళ చరణం మమ గురు చరణం.
రంగ విఠల పాండురంగ విఠల రంగ విఠల పాండురంగ విఠల శ్రీరమణి హృదయాంతరంగా శ్రీరమణి హృదయాంతరంగా మంగళకర కరుణాంతరంగా మంగళకర కరుణాంతరంగా ఆశిత దీన జనావనరంగా ఆశిత దీన జనావనరంగా జగదోధార హరి విఠల రంగ విఠల పాండురంగ విఠల రంగ విఠల పాండురంగ విఠల విఠల పాండురంగ విఠల.
When Swami started in 1991 Sri Sathya Sai Institute of Higher Medical Sciences, at that time, the number of patients who had access to cardiac surgery or cardiology was extremely limited because there were no government schemes. People were dying. And Swami, as he said in the inaugural speech, announcing that in 1 year he is going to have Institute of Higher Medical Sciences, he said, పేదలకు కనీసం రంగు నీళ్లు ఇచ్చేవాళ్ళు కూడా లేరు. And he also said, by the time they come to know what is wrong with their heart, they would already been bankrupt and on the street. Things have changed quite a bit across the country for better. It's not that bad now because government also has woken up and in the last decade has opened up schemes where people can walk into, by a public-private partnership, into decent hospitals and have some care. In 2003-2004, Indian Institute of Management, they invited Sathya Sai Institute of Higher Medical Sciences, and I had the good fortune of representing the Whitefield Hospital then. Every day, the number of patients who come to seek treatment here, the state which will be having overwhelming numbers for whatever reasons is West Bengal. And of course, I get from every state, is still astounding. That means, though we have this public-private partnership, though there are other hospitals which have taken up this role model and have started to do free cardiac surgery, the numbers are stupendous. So we need to actually rethink and see how we are going to take these things further. In this centenary year, I am hoping that the Swami's words of inaugural speech of 2001, 25 years we are actually lacking behind. We'll have to now make sure that his words will come true, which means that we'll have to turn a new leaf. When Swami said this hospital is going to serve for 1,000 years, I'm sure these are like banyan trees. They keep expanding and the entire outlook of the hospital will keep changing. We are at a cross-section of one point in the history of the hospital. So most important thing which I keep telling my colleagues is, History is not going to end with you. You are just a particle. You are here, you are not there. You have to make sure that the momentum is on. I can always say, this will be a crest jewel in the healthcare institutions of the world. In the 100th year, when this is happening, I see two angles. One is rededicating ourselves, revisiting what the Master said in the inaugural speech of 1991 and 2001, and make sure we take a stock check and see where we are and then plan. So I think we are here in a pause mode for a few seconds to see where we are and how to expand further. Expansion is what his mission is all about. And hospitals also will expand. And I'm sure in my own lifetime, I will see that expansion. And hopefully we'll be serving more people. What is the expansion about? Well, expansion is only about only one thing, serving more people. But the way I look at it is, as I said, A, rededication, and B, organization also must actually see where are we in terms of patient care continuum. And we want to see where are we positioned, what are the challenges what we have, and how are we going to change. With the explosion of the technology, what you have at hand now, with artificial intelligence, deep machine learning, big numbers, databases, we'll have to see and have a different type of innovative path to make sure, as I said, the bottom line is serve highest quality and serve as many number as possible, quality and quantity. There was a child who was refused to be operated, a 2.5 kilogram child, refused to be operated, and A, family was not having any finances, and B, no one was able to take that risk. We wanted to take up that case in Whitefield Hospital, and I thought I'll operate on him the next day. He had to be electively intubated the previous day. He had a successful surgery. Because it was a 2.5 kg child, he almost spent 1 month. He is absolutely fine, and the parents keep calling me once in a while to say that the child is absolutely fine. That was about 23, 24 years ago. To now, couple of months back, he is a child from Malawi. I don't even know where this country exists. I have come to know that there is a country called Malawi after the patients contacted. Somebody responded from the UK group, and they finally took care of the mother and child. The mother never had a tear in her eye, and she came all alone with the child. She was smiling, child was smiling. It was like a dream. Normally, you will have so many questions which are posed by the anxious parents. Here, there were no questions. We said, your child requires operation. She said, fine. I told the risk. There is a 2 to 4% risk of life. She said, fine. And the hope which she had till the very end is remarkable. That means we are able to make sure that through Swami's hospitals, we are able to serve someone and fulfill that hope. To finish the story, she calls me close to 1 a.m., standing in the queue of Qatar Airways, and she says, I need a letter from you to board the flight. I almost thought this lady is going to miss, because she's already in the queue to get into the flight, and now she's calling me saying that I need a particular letter. I said, fine, I'll do my best. I called my duty doctor, prepared the 2-page document, sent by WhatsApp, 15 minutes, and the doctor from Qatar Airways accepts, and this lady is on the flight. I woke up next day morning, she already landed. All she had was hope, that's all. Any other person would have gone bonkers, because you are standing and now they are asking you to produce a document. Whatever letters we gave, they said it's not sufficient. There is a particular format to fill. None of us knew. And I almost thought she's going to miss her flight. She never thought she's going to miss her flight. That is her hope. So if we are able to fulfill that hope in parents, in family members, that there is one hospital which will never care about money, which cares about purity of service and the quality of service, that is all our mission is done. And Swami says, don't bother about quantity, bother about quality. But here I should say, quantity is also important, provided you are able to make sure that quality is maintained. The reason why I say quantity is important, because that is the need of the hour. There are so many patients, lifestyle diseases have increased, diabetes is on rampage. We are going to be world's #1 in diabetes incidence in a couple of years. We are already the largest population of the world. That means we are going to have a lot of lifestyle diseases, many more coronary artery disease patients knocking at your door. And it means that we'll have to, as I said, change our policy and make sure. In fact, we have even relaxed Earlier we were saying beyond 60, we are thinking twice to operate. But now when I look at the patient, we just don't look at their chronological age. If their biological age is good and I think that they're fit to undergo, our guideline is the patient should be benefited with the operation they undergo and should have a long life. When we are convinced, we just go ahead and do the operation. And of course, we do the operation as instruments, and Swami himself, he takes care of all this. No doubts about that.
I'm going through a significant emotional flood since I came here. And every encounter that I've had with volunteers or other people has been very humbling. And it seems I was destined to come here. So I do know about the free medical care provided by the hospitals, both here and Bangalore. And I've heard from a lot of people, including my own wife, who has visited actually the Whitefield Hospital. This is like unmatched. But I didn't know nitty-gritties of how it works and what works and stuff like that. It is only when I was invited to speak on a specific topic that was given to me, I studied the model. And that's when I realized that there's a lot for public health, which is my subject, to learn from this model. Teach both providers, healthcare providers, as well as governments, as to how to reorganize or redesign or re-engineer public health services for the poor and the underserved. So that's how I have a different perception now, a forest view and a tree view. So the forest is this entire mission, and the trees are you all. So every doctor, every building, every volunteer, and the patient and the community, these are different trees, but they all make the whole forest. So you have the mangrove, you have the grapevine, you have the orchard, everything is here. But you cannot divorce the tree view from the forest view and vice versa. It's a very integrated, very cohesive, excellent model care that the world needs to see. So far, we talk about, when we say patient-centric care, we talk about right-based care. This patient's right to receive quality, affordable care. But what prevails here is compassion-based care. So compassion not only covers the right of the patient, but much beyond. Because then what happens is, if you say patient's right to treatment, then you also have to give right to the doctor or the nurse or the provider to gain a certain reward in terms of satisfaction, in terms of money, in terms of comfort, and also everybody's right comes. So you cannot fulfill everybody's rights in a right-based culture, is what my understanding is. But the moment you shift it to compassion, then a doctor would probably be ready to, spare an extra hour because there's a needy patient. It's not like, so you have a 12-hour, let's say, long neurosurgery, the doctor can't say in between, I'm not going to operate now, my 8 hours are over. So it's the compassion that motivates him to organize the care delivery. Similarly, the patients in the community will be more compassionate to the providers and the trust and the mission, because they are getting what they wouldn't get in a right-based environment. So it's a mutual interdependence in a compassion-based care design, which is missing from the whole world. Only in spiritual missions from any religion or sect or so, it exists. And what unique I see in this compassion-based model is this is massive. I've also worked with Ramakrishna Mission. They also have a very beautiful program, many others. But this is genuinely massive. And for many years, it's like 70 years, it has existed. And undiluted, rather more expanding. So if this can happen at this scale, this needs to be learned with the nuances of the model, because eventually when this will be replicated to an entire state or a country or a continent, then it will be easier for us to anticipate and preempt the challenges if we study the nuances in the model itself. So that's how I see. So my view is shift the paradigm from right to compassion. And that's how you also shift the ownership to the patient and the community to own healthcare. Swami Vivekananda also said every human being is divine, right? So doctors and nurses and in fact every medical provider has the opportunity to unlock the divinity, because there's a right opportunity in front to exercise the divinity within, provided compassion is the driver. So it's about equitable distribution of resources. So all governments are struggling with achieving universal healthcare. And for that, resources are the most critical driver. And that's why many times universal healthcare is also synonymously called, health insurance. But that's not true. We are talking about ensuring the right to care. So one is, if there is a bill on right to care for every patient, irrespective of caste, creed, and economic status, then there will be a mechanism to subsidize every unaffording patient's care. So currently, such a bill does not exist, because we only have right to health, right to life in our constitution. Within that, we assume that there is a right to quality health care, but that has to be operationally defined. Right to health care is not discriminatory between the have and the have not. It must be equally the best of standards. Now, for that, there are many mechanisms that we can learn from the Sathya Sai model. So one of them could be endowments. So if governments create endowment funds, then if this mission can generate so much of support, I heard it is 100 crore a year, the government will be able to generate millions of crores, because the government has power. It's all about the will and the compassion. So if one, a bill on right to care, and secondly, endowment funds for affordable care or universal health care are created, then the world will donate. So, because they are anyway donating, there's enough resources. So now, then what will happen is, the system will take care of it. That's where I talk about a forest view. The forest has systems. Every volunteer knows, what to do, what not to do, how to behave, how to dress up. It becomes part of the system. So currently we don't have the system, and therefore there's a lot of chaos. So once I think these two things happen, we can talk about many other things. So affordability will not be an issue if at the decision-making level, compassion becomes critical driver. then what will happen is education will change, the healthcare organization will change, the patient and medical provider interaction will change. I'll give you a couple examples. If you have, let's say, education, if we want to produce life-transforming education and thereby build a nation that is really the Vishwaguru that we talk about, then the education system has to invest in building people who are compassionate, who are visionaries, who can become lifelong learners, who are self-directed learners. These are skills we do not teach in our colleges, schools, and universities. But the moment compassion becomes the driver, because ultimately it is to build a nation. So therefore, the system will change the curriculum. So I'm talking about teaching doctors, not just clinical medicine. I'm talking about also teaching them emotional intelligence. What happens when a patient dies and there's a mob in the primary health center? It happens. How does the doctor maintain equanimity, poise, and at the same time empathy to the families of the deceased without getting disturbed? We need to teach this. This is transferable skill. And this is exactly what we're learning here. Right? So, similarly, how do you convince a senior person, like a medical officer talking to, let's say, a district officer or a state officer about allocation of a separate fund for a special mop-up operation for, let's say, immunization? So, this medical officer is, one, compassionate about the community, but he also needs the training to communicate to higher-ups in a language that the higher-ups understand the compassion that is driving the medical officer to talk. So today it is all about, letters, official letters that they write. If they learn persuasive communication for a compassionate community care model, the higher-ups will have better preponderance to understand and probably implement better programs. So I'm talking about paradigm shift in education as well as healthcare delivery by using compassion as a driver, not just a mere interpretation of guidance. But these are microsystems which have become a big Sai macro system. Now this needs to be translated to the rest of the world, even outside of the Sai ecosystem, is what I'm trying to propose. Yeah, I think, it's an opportune moment that probably the divine has decided to make it happen, I guess. I'm really honored. Thank you so much.
ॐ जय जगदीश हरे स्वामी सत्य साई हरे भक्त जन रक्षक पति महेश्वरा ॐ जय जगदीश हरे शशिवदना श्रीकरा सर्वा प्राणपते स्वामी सर्वा प्राणपते आश्रित कल्पलतिका आश्रित कल्पलतिका आपकान्धवा ॐ जय जगदीश हरे मातपिता गुरुदैवमु मरि अन्तयु नीवे स्वामी मरि अन्तयु नीवे नाद ब्रह्म जगन्नाथ नाद ब्रह्म जगन्नाथ नागेन्द्रशयन ॐ जय जगदीश हरे ओंकार रूप ओजस्वी हो साई महादेवा सत्य साई महादेवा मंगल आरती अंधुको मंगल आरती अंधुको मंदर गिरिधारी ओम जय जगदीश हरे नारायण नारायण ओम सत्य नारायण 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 ओम नारायण नारायण ओम सत्य नारायण नारायण ओम सत्य नारायण नारायण ओम जय सद्गुरुदेवा नारायण नारायण ओम सत्य नारायण 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 ओम नारायण नारायण ओम सत्य नारायण नारायण ओम सत्य नारायण नारायण ओम जय सद्गुरुदेवा नारायण नारायण ओम सत्य नारायण 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 ओम नारायण नारायण ओम सत्य नारायण नारायण ओम सत्य नारायण नारायण ओम जय सद्गुरुदेवा शांति 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 समस्त लोकाः सुखिनो भवन्तु समस्त लोकाः सुखिनो भवन्तु समस्त लोकाः सुखिनो भवन्तु ॐ शान्ति शान्ति शान्तिः जय बोलो भगवान श्री सत्य साई बाबा जी की